All right, good morning, everybody.
It's good. It's good.
To have everybody here. Got a couple spots in here, but wonderful to have a full packed room this morning. Welcome to the Salem Chamber, everybody. Thank you for starting your Thursday off today with us. I want to recognize a great slate of speakers today, and you can see there's a number of them. So we are going to be moving through our agenda today in quick order. A lot of important updates, and I want to recognize our business advocacy leadership team for helping Jameson put these programs together. Jameson is in the back of the room. Of course, if you're ever wanting to connect on anything within the political space here in Salem, Jameson's an expert there. I also want to recognize Dan Johnson, who is our marketing and communications director and does a wonderful job making sure that people who are not here in the room but watching are able to participate, and then of course keep these recordings published for you, and both for something to reflect back on and for individuals who missed today's opportunity, they can catch our content. So we have a great agenda today, and I want to start by introducing Nicole Palmateer Hazelbaker. Nicole serves as the Salem Chamber's contract lobbyist and is very in touch with what is going on, of course, at Oregon State Legislature. Nicole is going to talk to us about the forecasted budget deficit reduction, which we probably all saw, from $370 million down to $68 million. That is still a significant deficit, and maybe even provide us a little color on what is to come on with our ODOT gas tax referral initiative. So Nicole, we'll start with you. Thank you for being here this morning.
Thank you. It's a pleasure to see all of you. Happy December. Christmas is nigh. I can't believe it. I appreciate that Tom said I have insight. I always hope I do, but we always wonder, me and Representative Mannix, I'm sure. I'm going to start with the transportation tax repeal efforts. So as many of you have seen, No Tax Oregon has been busy, and we give them a lot of credit because they've largely done the signature collection through volunteers. They've utilized other resources, but it's a largely volunteer-driven effort. They have collected well above the 78,000 signature mark. Last I heard, I think we're at over 180,000 signatures. Those are in through the certification process that happens with the Secretary of State. So each signature has to be verified, that it was collected correctly, that it's a verified person who signed it, and all the things. Once it's certified and it's a go, then the relevant parts that are addressed in the referral from the House bill, in particular, the doubling of the payroll tax, will pause at the time of qualification. One interesting little note is, dependent upon when this is certified, if it's past January 1st that it's certified, employers would still have to collect the tax between January 1, when the law goes into effect, and when it's certified to referral. Once it's certified to referral, everything stops and it holds until we go to ballot. Clarifications being asked by a number of organizations about what that means as an employer. What do you do with that money? What happens? So more to be seen on that. Or if they happen to certify before the end of the month, then it would be a moot point. So what's next? So some options now for this. Leadership can decide that they're just going to let it ride and go on the November ballot. That's not a great move for the majority party right now. They're the ones who passed this increase in tax and fees. They probably don't want that to be seen on the ballot right next to a slate of Democratic candidates, including for mayor as well as the House of Representatives and half the Senate. It's just like, that's not the optics that you want in this situation. But that would be option A. They could change the date when this goes to ballot. In the February session, which we're coming upon, they would have the opportunity to change that and move it to the May ballot. I would guess that that's probably what they're going to do. If it was me, that's what I would do. I would move it to the May ballot and make that decision happen sooner. Put some distance between whatever that vote is and the primary election in the fall. Third, they could repeal it in February if they really wanted to. I don't think that's going to happen, but it could be done. It is an option that's out there, and they could throw it all and realize that maybe we need to start over again and have a different conversation. I don't think there's much of a chance of that, but it is an option. Generally, a tax like this that goes to ballot is going to win. It's going to be overturned. We pretty much know that that is the case. It's generally across parties. It's generally in large margins. So I would say that for the proponents of this particular increase in taxes, fees, and fines, they have some thoughtful moments to have right now and really think about, what do you want to do with this? Because you know what's about to happen. That's what I tell Rory when she makes bad choices. Like, what's about to happen here, child. When we talk about the revenue forecast, we had an exciting moment in accounting. So in September, when we had the last revenue forecast, the state was down 373 million from what the projection was at the end of session. And Oregon, as you know, adopts a prospective budgeting process. So we're going to budget to the money we think we're going to have for the 25-27 biennium, and we're just going to budget to that, and off we go. As we get the forecasts in and those are revised up or down, then we have to make adjustments. For the last many years, every revision has been up. This time it was down. In September, it went down 373 million, which left a gap based on what they had budgeted for and what they are now going to have. Panic and mayhem ensued, and the agencies were asked for 5% reduction scenarios across all agencies. They're asked to, what are they going to do? Stop travel, stop this, stop that. All those things have been kind of circulating around since then. However, we were in the building 2 weeks ago, and it turns out we had a much cheerier deficit. It's now 63 million at last count. Why? Some creative math. Very one-time. Agency dollars that were found, some refiled returns, a Powerball winner. Who knew? Powerball winners can change the whole revenue forecast. But there was a lot of caution in there. The economists were very clear, this is a one-time thing, don't count on this happening again. And that there was a lot of red flags in there: private sector job loss, slow population growth. Interesting to note, Multnomah and Lane County, which have been counties that have had strong growth, are now shrinking in size. Increase in unemployment, slower economic growth. All things all of you are well aware of. Those things are ones that the economists have put out there and said, let us not forget what's happening. But even so, the revenue will still ultimately be up this biennium from last biennium. The state still has more dollars than it did before, and it's projected to continue to grow. It keeps on going up. So what do budget writers do? I had some conversations this week with different members in the Democratic caucus, and I think they're deciding, and certainly Representative Mannix can add his insight here. What do they budget to in February? Do we budget to that 63 million deficit? That's not a lot in budget dollars. We have that much money sitting in e-board. We have that much money sitting around in place. It's not a big number. Do you budget to the 400? Do you start dealing with the pending Medicaid reductions that will happen in H.R.1, knowing that those start falling into place next October because we follow the federal fiscal year when it comes to Medicaid? What do they do? If I had to place a bet, I say they stick with the 63 for this because we're going into the campaign cycle, and then we'll deal with it as it comes. I don't think that's maybe the best move, but we don't know yet. Think that we're all having meetings with different budget writers and the budget co-chairs around different types of scenarios and what's good. It is an opportunity in some cases for different programs that maybe, if there's some of my clients we think are not great, like this is an opportunity maybe to suggest that this might be the time for them to go or reduce or different things like that. So I wouldn't say there's a strong sense yet of what exactly to do. Some of the caucuses have been meeting all week this week to try to decide which direction they want to go. So but we'll know pretty soon. So agencies have submitted those reduction options. They're about as popular as you can think that they probably are when you're talking at the Department of Human Services, the Department of Corrections, OIA, the Oregon Health Authority, all of them, every agency did. So what's really interesting though, is when you look at those reduction options to see in some agencies how much they can propose to reduce without impacting a single program. There's a lot of in these budgets, and you really see that when they're actually called to make reductions like this. Don't discount the impact of the campaign cycle in this conversation. It is huge. Who wants to be somebody running for office at a time when you're going to have to slash budgets? That is also about as popular as you think it is. So this is very much this weighing of all these things happening right now. But it was a very interesting, I told somebody, I said, in the morning before the revenue forecast, people are still walking around the Capitol, like someone kicked their dog. After the revenue forecast, it was much cheerier in the top. A couple quick things. Yesterday, the governor announced her prosperity roadmap. It's focused on economic development. It's on, as she has stated, retaining and growing business, creating jobs, accelerating economic growth. It will create a prosperity council, which will be comprised of business, labor, and communities, a chief prosperity officer. They want to take actions to fast track projects and modernize economic tools. The focus is on global commerce, foreign investment, trade partnerships, and large projects. How will they do that? We don't know. But I would say, and I mentioned this to Tom and to Jameson yesterday, not a lot of focus on small business at all. This is really talking about foreign investment, foreign trade, global markets, the really large businesses that are doing business here in this state, which I think is a really missed opportunity, an opportunity for the business community to stand up and demand some attention there. February session's almost here. It's just around the corner, right before Valentine's Day. The bill filing deadline is passed. Each member in the short session is only allowed 2 bills. Those have all now been filed. We won't see those. We'll see them in January, but we won't see them between now and then. They'll come out at that point, and we'll be excited to find out what happens. Again, we're not sure yet exactly how they're going to approach the budget, but I think that's going to start to become more clear. January 13th to 15th is the committee days where we'll come back into the session for those 3 days and sort of start to preview what's about to happen. And if I remember correctly, the turn in your bill day is right after that. February 2nd, the session begins. March 9th is a constitutional sine die. We have to be done in those 35 days because March 10th is filing day. If you'd like to run for office in an open seat, you must be filed by March 10th. During the short session, the deadlines run 1 week at a time. It moves very fast. So if you want your bill to keep going, you better be ready. Much easier to kill a bill in the short session than it is to pass it because we're just going so fast to get them moving, getting out of there. There will be, of course, a budget conversation, but as always, there's always some big policy items that we see in that short session, which can be challenging because you have such a short time to react to things and to try to do something with it, that it can be an opportunity or a challenge to pass something really large. But we are, on behalf of our clients, we're working on a variety of different things. But we've also had the opportunity to get rid of a bunch of different things that we didn't want to see in that short session. So with that, I'm happy to answer questions, and thank you very much.
Great, thank you, Nicole. I'll open it up to questions from our audience. Yes, TJ.
As you talk about, the pressure, the elections coming up, there's also the pressure coming from the Oregon Public Employees Union on Democrats to make sure that this tax stays in place. What kind of pressure are they bringing? Do they have that they can bring to bear?
Right. They have a lot of pressure because they are the largest funder of the Democratic campaigns. We are in a campaign cycle, so there's a lot of pressure there, but there's also an acknowledgement that the proponents of continuing the taxes in place are going to have to spend a lot of money to try to win that vote. That's not money they would prefer to spend. They would prefer to spend that on the candidates, but they're going to have to put money there. And there's been a lot of fundraising going on and asking for dollars to put those campaigns in place once this is certified, because I think they do very much understand how unpopular these increases in taxes, fees, and fines are. This is a hard one to try to beat on that side of the fence. But you're right, it's huge pressure. I read something this week though, where someone had said they're, different members of unions were surprised how many of their members did sign the petition though, because they're not that interested in paying an increase in gas taxes either.
Past President Sullivan, I will have a special invite to our audience at the conclusion of this meeting, but 1 week from today, 2 to 3 p.m., we will be having that exact discussion and taking our polling of our business advocacy membership. This is one of those unique times during the year that we're going to have a second advocacy meeting due to just the nature and how much content we as an organization need to bring to our membership. But we will actually have the unions here to describe why these dollars need to stay in place. So a little bit of preview there for next week. Next question. Yes.
Earl Richmond, the governor's talking about the economics of the state of Oregon, where you have Intech who moved out about 36 months ago, and now they received $1 billion plus from Indiana for free to have their next project there. And that should have been done in Lebanon already.
Yes, Nick.
Obviously,
Columbia CEO mentioned yesterday that they were considering moving out. Does that have any impact at the legislature? Would the whatever committee that's being formed to get businesses, it seems like that's a big business that they want in the state of Oregon, but they are yet driving that big business out.
I think the fact that he was standing there with the governor probably tells you what you need to know. I think that they're a part of the, and as they should be, they're a part of that conversation, and those are the kind of large businesses that this is targeted towards, and that's why he's there. But, you know, I would say his presence as a part of that, as part of that press conference is also a signal that is on that team.
Additional questions for Nicole? Fantastic. Next, we're going to stay on the themes of legislature and what is going on even nationally. And we're going to receive a Medicaid funding H.R.1 update and its local impacts from Ruth Miles, who is our government relations with Salem Health Hospitals and Clinics. Ruth, the stage is yours.
All right. Well, we're going to take a really quick romp through Medicaid and what's happening here in Oregon and nationally as well. So let's see if I can advance the, not yet. Here we go. Okay, we're going to talk a little bit about what Medicaid is. We're going to talk about Oregon's very specific Medicaid programs, national and state funding mechanisms, the big policy shifts and implications of H.R.1 or the One Big Beautiful Bill. I'm going to refer to that as H.R.1. It's just faster. And then kind of what to watch next. I'm going to have to get this up. I did this because I'm a visual learner, so I hope that is helpful for you. So just so you know, Medicaid is a program that provides health insurance for low-income people. It is a federal-state partnership that was created in 1965. In 1966, the federal government spent just under $1 billion on benefits for Medicaid. In 2024, the last year for which I was able to find numbers, the federal government spent $517.5 billion. This is what's called non-discretionary spending. So if you ever hear that term, it means this money has to go out the door. So the federal government doesn't actually know how much they're going to spend on Medicaid during a federal fiscal year, but they have to spend the money. So they have to budget conservatively. And so the vast portion of their budgets are non-discretionary spending. And then they're just working in the very tiny window of discretionary spending, what's left over from the revenues. So you see what that funding growth looks like. So this is a quick timeline of H.R.1. I know you can't see it, but if you want to nerd out on that kind of thing, please come see me afterwards. I'm happy to share this information with you. H.R.1, or the One Big Beautiful Bill Act, is a reconciliation bill that passed last summer out of Congress, signed into law by the president. It has a lot of provisions, right? Tax credits and all kinds of things, but there are a lot of Medicaid specific and healthcare specific provisions of this bill that are important to know. Some of these provisions have begun to roll out this year. Most of them, if you look at this timeline, you can see hit 26, 27, 28, and go all the way through 2031 when the last element is implemented. However, I might just add that if Congress acts, all of this could change, right? So everything that I say today is based on what's happened now, not based on what, my prediction of what Congress is going to do or not do. Okay, so Oregon has 3 types of programs, and I'm simplifying this. They have Oregon Health Plan, or what's now called OHP Plus, because Oregon is a Medicaid expansion state. This means that we pull down a lot more federal dollars to pay for Medicaid. It covers people up to 138% of the federal poverty line. The federal poverty line right now for a family of 4 is $32,150. That's annual income, right? So 138% of that is about $44,000 for a family of 4. So just to give you an idea of that. In addition to Oregon Health Plan, we have Healthier Oregon program that provides benefits through the Medicaid system that are essentially exactly the same as OHP for undocumented people. And then last, there's the Bridge program. This program was created by the legislature fairly recently, and it targets people that are between that 138 and 200% of the federal poverty line. This is what the state calls the churn population, where their income they go in and out of eligibility for OHP. And especially for kiddos, this thought was that this will help them kind of bridge the gap between where they are and where they can afford to buy insurance on the marketplace or be able to get it through an employer. Oops. Okay, so let's talk about the money part of this. There's a lot of money involved, as we talked about. So we've already talked about that 517.5 billion that the federal government spent in 2024. In the same year, Oregon spent 4.6 billion of taxpayer dollars, and then the feds chipped in 11.5 billion. So just to give you an idea, this is just for OHP plus. This is not for the other two programs. We're going to talk about how they're funded in just a second. And the people who benefit from this, it's a pretty significant chunk of the population here. Statewide, it's 34% of people all ages, 58% of kiddos. That number has grown slightly over the last year. And then in Marion and Polk County combined, it's 38% of people all ages. So these are our neighbors. So the funding mechanisms are different for these different kinds of things. So traditional Medicaid is funded by taxpayer dollars, but it's federal dollars with the state putting up matching funds. Oregon is a unique state in the sense that we rely heavily, I'm saying that that's probably not the right word. The state relies heavily on what are called provider taxes. So they tax even nonprofit providers like Salem Health. And this provider tax is used, the revenues from that are used to put up the state's matching funds. So there are other elements that go into those matching funds, but Oregon has a very, very, very heavy reliance on this compared to other states. At the federal level, this is seen as a shell game to just pull more federal money down than the state ought to be able to pull down. And if you kind of look back at the spending that Oregon has done, Oregon has spent a little bit more on Medicaid than other states if the money was just divided evenly among 50 states without regard to population. And as you know, our population is not that big compared to other states, right? So we're spending above we're spending above our level. So that's kind of an important thing to note about Medicaid. So let's talk about the other two programs. The Bridge Plan is funded through tax credits. So these are low-income tax credits that were created when, it was in 2010 with the Affordable Care Act. These are not the expanded advanced premium tax credits that were at the center of the government shutdown, but they are still a little bit at risk. So they're permanently in law, but Congress again could act to change that. So important to note about that, that the funding source isn't particularly stable. Healthier Oregon, on the other hand, is funded straight out of general fund dollars. So all of this is taxpayer dollars in the end. So all of it is coming out of our pockets one way or the other. But that Healthier Oregon, there's about $1.2 billion that the state has budgeted for the current biennium. So it's actually a fairly small enrollment statewide. However, we'll see if this program survives budget cuts and then also changes in federal eligibility. So just a quick kind of perspective on what this looks like from a provider perspective. Oregon reimburses hospitals at about 56% on the dollar for the cost of care. So imagine this, like if you're selling something to someone, you've already done all of the work to provide whatever the service or the good is, and you're only getting 56% of your actual cost, not your price, but your cost. That's the position that we're in here for Medicaid. Some direct payments, or what are called non-claims payments, raise that figure a little bit, but it is never going to get to 100%. And the federal government is certainly not going to get into parity with actual cost of healthcare. Medicare is also below the actual cost. And so that makes Oregon's continuum of care particularly fragile. Some of you may know that yesterday, Asante announced that they were closing their Ashland Community Hospital. They're going to continue providing emergency services there and a few others, but they're closing all of the beds that are there. And this is because of the fiscal environment that hospitals are in. as you're seeing kind of what's happening with H.R.1 and what's happened for many years with reimbursement and this sort of increasing fragility, I promise you, this is just the first of some changes in the healthcare continuum. Okay, so H.R.1, let's talk about that. And I'm going to see if I can find my way back to my notes here. So the CBO, or the Congressional Budget Office, estimates that H.R.1 will remove $1 billion from Medicaid funding. That's more than what the federal government spent in 2024. So it's an interesting number. I'm not sure that I believe that. The state's estimate is that it will remove 12 billion over 10 years of Medicaid funding here in Oregon. That is a big chunk of money. So that's something that I'm paying attention to. Finding my notes here. So policy shifts with H.R.1. The eligibility will change over time. So part of the bill says that certain citizen groups or certain resident groups, people who are undocumented, DACA recipients, new green card holders don't have access to Medicaid. Some of that is phasing in now, and some of it phases in future years. And then budget neutral waivers are another really big policy change. Oregon has operated on what's called an 1115 waiver. It's a demonstration of how we want to do Medicaid in the state. We have operated under a demonstration waiver since OHP was created. So there is a question about, do we know what we want to do now? But I will tell you that the social determinants of health spending and some of the other elements like covering people who are incarcerated so that they have a bridge to when they get released, eligibility redeterminations every 2 years, those things make our waiver not budget neutral. So we are going to have to see some changes. The state's going to have to ramp down spending on Medicaid, and hopefully they'll take off some of the Cadillac pieces and not all of the important pieces. Another really important shift that H.R.1 introduces is what I call the healthcare Hunger Games. This is not my term, but there is a $50 billion rural health transformation fund that was included in this bill. This appropriation goes out over 5 years, beginning January 1st, 2026. Our state has applied for an award, so half of that 25 billion gets dispersed to states that have an approved spending plan. There is no methodology that says every state gets the same amount. There is no methodology that says every state gets the same amount based on population. But I will tell you that my colleagues in red states have already been promised amounts that are above what those numbers would have been if it was shared out equally. So I don't have high confidence, nor does Oregon Health Authority, that we will receive an award at the 200 million per year mark, which is what the federal government had them budget to. But the race is on because that money is supposed to go out the door of OHA and to providers. It is not supposed to take the place of lost Medicaid funding, but instead it's supposed to do innovation, right? To reduce reliance on state and federal dollars. But this really, really introduces a whole different element of competition right now among healthcare providers. So there are some opportunities like anything else, right? Whenever there's change, there's opportunity, but there's also some things to watch that you need to know about. So the rural health transformation funding is definitely an opportunity. Yep, you betcha. And then provider taxes. I mentioned that the state has this high reliance on provider taxes. Those are going to be ramped down by this bill. In 2031, the state has to ramp that down to 3.5%. Interesting thing, there's no talk about reducing the rate of the tax to providers, only the amount they can use for matching funds. And so that's something to watch, because if that provider tax stays at the same rate and is not coming back as reimbursement to providers, your healthcare is going to get more expensive. Oregon is going to have to spend a lot of money to comply with this bill. They'll have to do redetermination of folks that are on Medicaid, to make sure that they are still eligible every 6 months, not every 2 years. In addition, they're going to have to do, I think, monthly checks of their entire Medicaid rolls against the Social Security death file. states have really, really dug their heels in about this, and Oregon is on notice because Oregon has paid out, I think, 29 million last year in benefits to people who were already on the rolls of other states. And so this is part of a Secretary of State audit. So they should know about this, that they're on notice, but they're going to have to spend a lot of money. So some of the budget things that Nicole talked about, a lot of money is still going to go into Oregon Health Authority. I don't anticipate cuts for them. And so a couple of things to just watch as we move forward. Payments are probably still going to fall short to healthcare providers. And so that fragility of our healthcare continuum is going to continue. So people who are on Medicaid may have very rich benefits, no copays, no cost sharing of any kind, not like you and me, but they may have difficulty finding a provider who can afford to see them, right? And that's the case right now. It's going to get worse. And then last, got to watch that continuum of care because once a hospital closed down, once individual practices closed down, it is very, very difficult and costly to get them restarted, especially in Oregon that has the healthcare market oversight program that really watches every single thing that has to do with healthcare. So that is what I got. And I know I don't really have time for questions, but I'm happy to nerd out with you afterwards.
Ruth, first of all, thank you are we able to utilize this document within our organization to educate our members? Thank you. Great. We have just about 2 minutes for Q&A for Ruth. Open it up to Jeremy.
Thank you.
Hi, Commissioner.
I have a question, maybe it's for the room, but with a lot of reduction of revenue from OHP provided services or paid services, how do you think that will affect the commercial insurance marketplace? Will that put more pressure on premiums or pressure on employers to provide better benefits to employees who may be otherwise eligible for OHP? So.
Yeah, so this is the elephant I was dancing around and trying not to talk about. But the fact is that because there's under reimbursement by Medicaid and Medicare, and then we have still an uninsured population in Oregon. And so at least at the hospital level, we're paying for that care, right? And because those reimbursements don't cover the cost, then there is cost shifting that goes to commercial insurance. That's why it's more expensive to buy benefits if you're an employer. That's why it's more expensive to buy benefits if you're buying on the marketplace. And so I think that we are close to a breaking point with that. Insurers are pushing back extremely hard on hospitals. We're in a situation like that right now with one of our payers. Some of you may have read about that in the newspaper. Hopefully we come to some resolution because our goal is to continue providing care to people in our community. But it has become increasingly difficult to do that and to stay solvent, let alone invest in the ways that we need to. So that's a whole different presentation.
Yes.
We think that these cuts will increase actually access to care.
That's a good question. And I think that there is a possibility that for your primary care specialists and sort of, I think that you may actually see some relief, right? Make it easier for you to find a provider or to see your provider more quickly. However, I think emergency rooms are going to be hit. You all know, I think by now that Salem Hospital has one of the busiest emergency rooms on the West Coast. And I think that, the same people are still going to get sick. And if people defer care, we learned this from COVID, they'll be sicker when they come to the emergency department. And so I think we will probably continue to see crowded emergency departments with people who are not eligible for Medicaid in the future that are now, who are using that for primary care and emergency care and all the things in between.
Last question, Director Blair.
So my numbers may be wrong. I think since 23 HOPs grew by like 20,000 individuals. I mean, do you see that continuing with the numbers you see? Because that's general fund, right?
It is general fund dollars, absolutely. And there is that's a big question. I'm not sure that it is. It's a big lift for the state. And I have a question about whether or not the federal government will continue to allow that, because there are clear prohibitions against states using the Medicaid system to deliver benefits to people who are undocumented. So that raises a big question in my mind about how that will affect an award under rural health transformation funds, how it will affect all the other money that Oregon tries to pull down from the federal government. Some of you know that we're having difficulty getting anti-terrorism dollars because the administration is saying you need to deal with the anti-ICE protests, right? So, without getting political, it is a political matter. And I promise you, my colleagues in red states are not having this sort of sleepless night issue. Thanks.
Welcome to Oregon. Ruth, thank you for your presentation and the work that you do at Salem Health. Ruth is a consistent attendee here. And in speaking with her leadership team, we really appreciate her participation in this organization. Next up is your representative from House District 21, Kevin Mannix, who is going to give us a legislative priorities and preview of the short session starting in February. And maybe touch on just very briefly his death tax initiative, but do know that is the second part of our special program next week. So you notice Kevin not deep diving that. Understand that's because in a week from now, we will have a full 30 minutes on that presentation and also hear from the Public Employees Union as to why this would be a catastrophic thing for Oregon. Representative Mannix, the floor is yours, sir.
Thank you. Good morning, everybody. First, I'll mention Gerboth now is going to pass down. We have held back on the death tax petitions because I didn't want to get in the way of the transportation gas tax referendum. But they have now succeeded in gathering the signatures they needed, and they had a December 31 deadline. We have till July 2026.
I don't like that phrase, death tax, for the oldest guy in this room.
I'm sorry, Dick. We are talking about eliminating the death tax for all of us. And I'll just say that I've got petition sheets with information, the text that we're just going to pass around, and I'll say nothing else about it. But we weren't doing this kind of thing before because I didn't want to get in the way of the gas tax referendum. But now we have gas tax referendum people contacting us. All the people that did Tillamook County, for instance, contacted us yesterday. Hey, now we want to help you. So we're moving in the direction of shifting over much sooner than we thought, because we thought we'd be waiting till January. So
You have to fill this out. And
now I want you to everyone take one home to your business and get people to sign it and then mail it in. There are 10 line petition sheets, which I usually have not been distributing, but now we're opening the floodgates because our referendum friends have accomplished their goal, and so we won't be getting in their way. We're looking towards a legislative session where the phrase I would use is it's complicated. Is it complicated? For once, the state government, once in a while, we have to take a look at the reality of the budgeting system. And the budgeting system right now has a lot of bias in favor of continuity of expense. In fact, every time we come back for a regular long session and we're looking at the budgets, they always present them based on anticipated increase in expenditure to maintain their programs. In other words, it's going to cost us this much more. So that's the starting figure. It's never based on how do we take a look at what's inside. There's one agency, which I won't mention in too much detail, which has 21 high-paid salaried employees who are dedicated to diversity, equity, and inclusion. And it is not the Economic Development Department, because they have people that are there to make sure we meet the federal requirements. 21 people, and this is money we're spending on a topic where you might have one or two people in an agency to making sure you're meeting all the legal standards for fairness, et cetera. That's the kind of thing that's still built into budgets. I don't want to give the whole speech on the details, but the point is that if we go back over the last 5 years or so and take a look at the additional mandates that we've imposed on counties and cities and school districts and simply pull back those mandates, suspend them at least, we can make a big difference in what they have to spend, but also in what the state has to spend. Example, not me, but 31 people in the House voted in favor of a requirement that classified employees of the school districts would be eligible for unemployment compensation during the summer. Normally, they were thought of as 9-month employees. That's the end of your job. You weren't laid off. And during all of my previous service as a legislator and all the 22 years I was gone, the legislature never mandated that classified employees of school districts be eligible for unemployment compensation. Why is that an issue? The state and local government entities are self-insured on unemployment. And that means during the summer now, the school districts are spending 60 to 65% of the pay that they would be giving as unemployment benefits for people who they previously had to pay nothing to. And for somehow Oregon's survived for the 30 years I've been involved in the political process without doing this. But now the legislature has mandated it. That will cost about $40 million a year statewide for the school districts. Could be money used in the classroom. Instead, it's going to be money paid out through unemployment compensation. I've already brought up with one of the co-chairs of Ways and Means, why don't we suspend some of these mandates? Why don't we change the laws? And if we can't do it permanently, how about doing it temporarily? Say, we can't afford to do this stuff. So you're going to see a host of conversations, mostly in back rooms, about what can be suspended, better yet, eliminated from the mandates that we impose. And I'm talking about school districts because you have elected school boards. They are forced to do a number of things that are expensive, and yet the state does give them the money. I could go on too long about it, so I'll just say one of the themes has to be a reform in terms of affordability and an understanding that deregulation and elimination of mandates can make a difference. And it's going to be a political discussion throughout the year. Now, as to what I get to specifically do, I will be involved in mental health. I'll be involved in behavioral health is really the general phrase, because I'm on that committee. I'm on the Judiciary Committee. I'm on the Transportation Policy Committee, and I'm on the Housing and Homelessness Committee. One of the issues there is if you want to talk about affordability, let's talk about reducing the cost of building a house. Let's talk about the systems development charges. So there's 1,001 things, and we're compressing this into 5 weeks because it's the short session, February to March 9. What I am doing is focusing on two things that don't have to go through the Ways and Means process, because if you go through Ways and Means, the Money Committee, the bill's probably dead if we're spending more. If it's spending less, it probably doesn't need to go through Ways and Means. But I have two bills that we're working up. One is Crystal's Law. And the short story here is a young woman who's being stalked dangerously in Colorado. And law enforcement issued warrants to get communications records because they wanted to track down the stalker. By the time the records were provided, the woman had been murdered. And when they looked at the information they could have had earlier, they could have tracked down and arrested this violent stalker. And her name was Crystal. It's called Crystal's Law. We're going to call it that. We'd be the first state to say, when there is a warrant for communications records, right now it's first in, first out. They just do it in the process of what comes in. And I understand that. They have the capability to expedite if they're required to do so, but they're not required to do so. And this bill would say, if the district attorney has a warrant from the court that says we have a potential very dangerous situation for an individual at risk, you must respond with this information within 48 hours. Had this law been in effect in Colorado, Crystal would not be dead. As soon as they had this information, they identified the perpetrator. And by the way, it also exonerates non-perpetrators because someone else was suspected and they realized this person didn't have anything to do with it. So Crystal's Law will become a single bill. I've also got Senator Prozansky, the chair of Senate Judiciary, as a co-chief sponsor. And it does not involve spending any more money. It does involve telling Google and all these other communications entities, when you get a warrant that specifies this emergency, you will respond within 48 hours so we can track down the offender. That will be a very important bill. Colorado will have a similar bill, and we'll probably be the first two states to do this because no one ever realized how important this is. And so as we do it, it'll be a guide for other states to do it, and eventually maybe Congress. So that's one of the major bills I'll be doing. I'm only allowed two. The other one has to do with payroll taxes for transportation. And I know the friends from Chariots are represented here today. My view is that any entity that wants to impose a payroll tax has to have approval by the voters or has to have an elected board that's responsive to the voters. And the current payroll tax situation involving Chariots is based on a statute that authorized the board to impose taxes. And the board is not an elected board. And let's just say this is going to be a bill that's only targeted at, it's not Lane County, it's not Metro, it's not anything up in Portland. It has to do with, there is a separate statute that authorized the Chariots to go ahead and impose a payroll tax if they would like to. And this will say, no, you need a vote of the people if you want to do it. Very straightforward. And it's going to be quite a conversation. But I've decided I need to take on that challenge. It's an affordability issue for this community. We need to find other ways to help fund transit. And I'll be working on that, but not through this payroll tax. As to the totality of the session, it's a very short session. I think that there'll probably be an effort to move up the gas tax referendum, the transportation tax referendum to May. I have mixed emotions about that. I think it's better to have some certainty as to, I think it's going to be that tax, that whole transportation tax system is going to be defeated by the voters. It'd be better to know sooner. On the other hand, politically, yes, the Republicans would like it to be on the ballot in November because they can beat the Democrats up because it's a Democrat process. My view is it'd be better. I'm going to be okay if they want to do it in May, simply because we need to know what was going to come down. I do want us to be talking about affordability because that is a, excuse me, this morning, a concept which we need to push. It has to do with the taxation scheme. It has to do with the regulation scheme, and then essential issues, education, public safety, including fire, emergency services. Those are critical elements, and healthcare. And on the healthcare side, God bless you. It is so complicated. We need to take a step back. My law firm will have its 40th anniversary in January. And for 40 years, I've been meeting payroll twice a month, but also paying our health and dental care insurance premium at the end of each month. And I've watched it skyrocket. And that is a real challenge for all businesses. And we are subsidizing a healthcare system that is not doing its job. So I think that will be a continuing dynamic for the next session, but also going on through the election season. What do we do to reestablish affordability and eliminate the regulatory nightmare that you have to go through when you want to build houses or other buildings? The anti-development regulatory process we have right now needs to be reformed, and you'll be hearing more about that.
Kevin, I know Nicole had to depart. Can you take a stab at this in her absence? Jameson and I were kind of talking, is there a way that we can see each legislator's two bills they intend to take to
You can
the,
ask them.
so it is not a
Not
public,
till January.
Okay.
You will see them in January. And I've chosen two bills that do not have to go through Ways and Means. And Crystal's Law, I was honored that the District Attorneys Association came to me and the national people concerned about this issue came to me, because I have been a real champion of anti-stalking laws, domestic violence laws, and this fits in with empowering our law enforcement to act to protect our people. And I do think that we'll have broad support. Senator Prozanski being co-chair, he's, a lead Democrat in the Senate, not co-chair, co-chief sponsor. It makes a big difference. And I do think these are examples of things we can be explicitly addressing an issue. And look, all the major communications companies, they can respond in 48 hours. They've got the capability, but they have so many requests or demands that everything gets just, first in, first out, last in, last out. No, this is a special category. And that's an example of the kind of thing we ought to do to be straightforward about helping protect the public.
Commissioner Mordhorst, first question.
So thanks for being here. The governor authorized the LCD to come up with plans for housing and just released their new regulations for housing. It's 411 pages. Is there anybody that's going to be taking that up? Housing club?
Well, my view is it ought to be one sentence. I'm serious. Please go out there and build housing. And by the way, you can follow the standards that existed 5 years ago, except for building code modernizations that have to do with safety and health. And in other words, we ought to just eliminate the regulatory nightmare. So my response is it's too darn complicated.
No questions for Representative Mannix. Yeah, great work, Kevin. Thank you for your work. And
My wrap up is the death tax petition. It not only eliminates the state death tax, it forbids counties and cities from imposing their own death taxes. And I'll be talking about that up in Multnomah County, because the next thing you'll know, Portland or Multnomah County will come up with another tax of their own. And this says you can't do it.
Thank you. Okay. If we have additional time at the end, we can take additional questions. We're going to shift to locally here in Salem. It is a pleasure to welcome our Salem Fire Department Chief, David Gerboth, to this audience. Chief Gerboth is going to go through a preview of our co-response model and support from Marion County Commissioners, which is some developing news on this model. Chief Gerboth, the floor is yours, sir.
Thank you. I want to see everybody, if that's all right. Thank you for having me here today. I think it is incredibly apropos that I get to speak today on the evolution and innovation of the Salem Fire Department on December 4th. December 4th, 1857 was the birthday of the Salem Fire Department. Today is the 168th birthday of the Salem Fire Department. So years before Oregon was even state.
Man, it's that day, isn't it?
Cutting. We've appreciated your support the whole time, sir. So before statehood, this organization was protecting the community and the capital of what was then the Oregon Territory. And we were certainly born to fire. We still go to fires. This year, we've gone to more fires than we've ever had in our history. But we've also seen an evolving organization that continually adapts to community needs. And whether it was in the 40s and 50s, and we started rescue companies, or in the 70s with paramedicine, in the 80s with hazardous materials, we've become this all-hazard organization that is serving the community in many different ways. We have a technical rescue team. We have a hazardous materials team, airport rescue firefighting. We're members of the SWAT team for Salem PD. So this is a further evolution of that and how we can best serve that community. So we are, I will tell you, a organization at capacity. In 2011, we ran 17,000 emergency calls. And this year, we're going to probably end up close to 40,000 emergency calls, more than double since 2011. We have 4.6 less members on duty every day. So we're an agency at capacity, and we have seen a change in society and how we respond to calls. Behavioral health, as the representative mentioned, has become a huge part of what we're doing. Substance use and abuse is a huge part of the calls that we're going to now, and huge utilizers of 911 system that are using it for their primary care. And so is the best way for us to send a fire engine to all of these incidents, because that's really all we have. And so what we are doing is looking, can we send the best resource at the best time to the right place to give the best level of service. And so what we're proposing is what we're going to start as a pilot program in January. That is going to be, we call it the REACH team, Rapid Engagement and Community Health. It's going to be a model that is a partnership between Marion County and the city of Salem. We're going to staff it with a Salem Fire Department paramedic, an emergency medical technician, and then a mental health professional from Marion County. The intent is to respond to the incidents that really shouldn't be done by firefighters and a fire engine. We're at capacity. They can be used for higher acuity incidents, and then have the proper training to deal with those particular types of events. Mental health is something we're responding to often. Our firefighters are not trained best to do that. We'll have a mental health person there to help with that. On the substance use and abuse right now, we go to a large number of overdoses, a large number of substance use. what we do right now is, we have basically one tool in our toolbox. We use Narcan for those opiate. We arrive, generally those, people in overdose or in respiratory arrest or on the verge of death. We provide Narcan within 20 to 30 seconds. We've now, eliminated that. Now they're up, alert, and they're in withdrawal and they're running away, and we've saved a life, but we've done nothing to help that situation. We're going to help provide, we call it Suboxone. It's a medical assisted treatment that not only stops it has Narcan in it, stops the overdose, but it also prevents the withdrawal. So hopefully we can engage with somebody, have a conversation, and start getting somebody into resources. I'm not naive. Been in this job 34 years. I've been to plenty of these calls. Doesn't happen always on the first time. Sometimes it's the 20th time. But being involved in community health programs since 2003, I've definitely seen the advantage to the community and how it can evolve. I will tell you one thing that we shouldn't just dismiss is the fact that this is a partnership between the city of Salem and the county of Marion, right? And so for our city councilors, we have one here, and I don't think we have any commissioners, but this is a pretty big step, and to have that partnership, I think it's going to be a catalyst that leads to better partnerships in the future. And I will say, so some of the measurables we're looking at, can we take the 911 calls off our heavy equipment and let them available for higher acuity calls? Can we treat people in the best way and really provide different treatments, get them connected with services instead of just responding and leaving? Can we look for alternative destinations? We talked about the emergency room. We do have, as mentioned, one of the busiest emergency rooms on the West Coast. And do we need to further inundate that with people in mental health crisis then the emergency room is not designed for that either. It's not the best way for treatment. So we're looking at other ways. Can we bring people to other places? Can we reduce the burden on the 911 system, reduce the burden on the emergency room, and then reduce that load on our heavy equipment? I will tell you, I think of three really short-term, medium-term, and long-term goals. We are starting the pilot program in January. It's a 6-month pilot. That is our short term. We're going to evaluate that. That'll be constant evaluation with those metrics to make sure that it's effective. If we do see that it's effective, then we're going to make a proposal that it becomes full time. That would be, I think, our medium term. And then I've been asked, what's the long-term goal? Well, to me, what the long-term goal is that we're coordinating with so many different resources in the community that I would hope that this type of program is no longer needed and that we don't have to have it in our community because we've all worked together to solve some of these ills. So with that, I will answer questions, but I will close with this. 168 years, and there's really only 2 reasons that happened. The members of this organization and our community support. So I want to thank you all for that.
Thank you, Chief.
Nice.
Yes, Andrew.
You mentioned putting less strain on the emergency rooms and utilizing other avenues. What do you think those avenues are? And then follow-up question, if those avenues are state-run facilities, is there any partnership with the state?
Yeah. Let me start with avenues, right? So Marion County just opened a new behavioral health behavioral health. Help me out, Chief.
Crisis Center.
Crisis Center. Thank you. Crisis Center. 1, 2, 3, 4 commercial. I know that. And so we can bring people in mental health crisis there and not have to bring them to the emergency room, right? So that's one area. We have talked to different urgent care. So we bring somebody in urgent care that has a wound or something needs to be treated, but does not need to go to the emergency room. Bridgeway is working on building a sobering center right now. And so they're looking at opening that around March. We're already having conversations with them. Can we bring people that are substance use and abuse into the sobering center? So those are 3 of the areas. As far as state, we've had conversations very little with the state and the state hospital. They're pretty much at capacity. I don't know how much state help we're going to get. I will tell you though, it makes me, when we think whose responsibility is this, right? To do this work. And is it really even our responsibility? Is it the city's responsibility? Certainly, I think state and federal government has a huge responsibility in this. And so that state funding that comes down to Marion County, they have a responsibility for mental health, and they are stepping up and partnering with us. But the fact is, for the fire department, anybody calls 911, we're going either way, right? And so we're going to go to these calls. So can we do it in a better way that will serve our community in a better way?
Additional questions for the chief? Yes, Mark.
For us that live in the other side of the river in Polk County, has Polk County talked to you at all about helping, especially on the west side by the river?
So I'm well aware that these needs do not stop at the river, right? And so this is a pilot program with Marion County. It's interesting. We had a meeting on Wednesday or Tuesday with Marion County, Polk County, City of Salem together to talk about specifically those challenges. Wallace Marine's a great example, right? We're talking about that. We know the challenges that are over there, and can we do this collaboratively? Because this same problem goes back and forth on each side of the river. Right now, it's a pilot program for Marion. We're going to have those conversations, especially now that we're working with Polk and Marion County together. Is this an option to cross over the bridge, right? We're going to have those. At first, we had this conversation, hey, we're going to stay in Marion County, but after this conversation we've had this week, I think there might be some openings to do that. However, after 6 months, we'll see how that develops and if we can do that, expand it.
Commissioner Mordhorst.
Just for the record, Polk County also built a crisis center. For the same reason. So we are looking at the same program.
We've had conversations. There's a care center over there too that we're already engaging with in Polk County.
Chief, how will you know in that 6-month time period whether it is successful?
Yeah, so we have a number of metrics that we're looking at, number of contacts. How many people have we got into care and gotten? How many times have we been able to alleviate a heavy piece of equipment from a 911 call? How many times have we been able to divert somebody out of an ER and put them into a different area so we're not inundating our ER? How many times do we eliminate transport out of an ambulance? Because we don't want to keep transporting people in our ambulance system. So we have a number of metrics that we've agreed to with Marion County on how we're going to measure that.
Is there a goal? Is there a number goal that we want to prevent 10 people a month?
Right. You know what? Not right now. I think we're gonna look at and see how it actually evolves. Coming from another system, looking at the number goal was one of the big things was reduction in 911 system users, high utilizer users, right? So right now we were talking about this yesterday, our top 20 system users, right? As we use that for preventative. We have one lady that has called 911 259 times since March, right? And those are the things we can do preventatively. We'll have a response option, but the other part of it is that preventative care, engaging with those people before they call 911 so we can get them the right care and then not bring them to the ER 259 times.
And just to add to that, we're providing some numbers of, what it looks like for ED visits and specifically visits by homeless people as well. So just to give them a baseline for what's happening now, and then we'll redo that data throughout the pilot so that they also have that input. So we have big hopes for this.
A challenging discussion in my work in volunteering with Be Bold Street Ministries and Union Gospel Mission. There's a face of homelessness is very different on the addiction side, but on the mental health side, I believe her name is Janet. You may have seen her anytime you're coming off the on-ramp. Janet spends all day taking one pile of clothes and moving them 3 feet left, over and over, hunched over. Have you seen that lady? Okay, that is not, she is verified to not being on drugs. She is mentally unable to take care of herself and is homeless. Kevin, if I could say anything, there has to be some this woman is a very real person that many people in this community have seen, and is hunched over all day long, shaking out clothes and putting them 1 foot over to her left, and then reverses the process. It is inhumane that we allow that to be out there. She needs deep help, real help in a facility that we do not have the capability in our city or county to take care of. So
Can I jump in on that?
I'd love it.
The state has lacked vision in dealing with these issues. We have a former state facility called Hillcrest, which is about 45 acres in central South Salem, which used to be a juvenile detention facility and the like. And there was a lot of other stuff it was used for. The state sold it years ago. The buyers wanted to create a drug rehabilitation program. And they spent 5 years trying to get the Oregon Health Authority to give them a certificate of need, and they gave up. So now they're willing to sell the property back to the state or lease it to the state. And I'm saying this out very loud because I've been trying to get the state to pay attention. That facility generally needs renovation now after years of non-use, but it's a facility where there are a couple of buildings right there where some mentally ill people who are not dangerous but need to be housed, could be housed. And the compassion side is, you have food and you have a place to stay, and there's a program where you're expected to be there. The state hospital was changed into an intensive mental health facility where almost all of the persons that are in the state hospital are there because they're under criminal charges.
Correct.
And we dropped it from 3,500 to 515 beds. Well, that was all fine, except when we got very aggressive about the criminal justice system, where the defense attorneys assert lots of their clients are unable to assist in their own defense. So they end up having to be evaluated at the state hospital. Well, I don't even want to give the 30-minute speech about that. But what I'm saying is we need physical facilities, and the state keeps looking to the counties and the cities and nonprofits when the state itself should have step in. And here is one example of, how do I say this nicely? The ill-advised regulatory scheme. We now insist that any buildings used or released by the state are going to be, I'll call them earthquake proof. And the dome building at the state hospital is a good example. It was built in 1904. Somehow it's still there 121 years later. It does not qualify anymore to be used for any state programs because it would cost $10 million so we could resist the big one. I would like us to just use it, and that'll be a separate conversation with Hillcrest, and I like to call it Hopecrest now. The owner is willing to modernize it and lease it back to the state. And yes, this is a clarion call. Can I get attention? I'd like to open up one of those buildings right away and say folks such as this woman can be brought there and provided with some compassionate oversight. And it's not going to be a treatment program that's going to change them. It's going to be a treatment program that simply supports them. But your point is well taken. And this is where we need to get back to basics in terms of what we do as government.
I'm going to set up our next conversation by, first of all, making you aware, if you have not yet, Councilor Shane Matthews.
And we did get that.
A local buying platform. And we'll hear more about that from Josh Eggleston here in a moment. But make no mistake, this was by the leadership of a city councilor who also happens to be a business community member and understands that what it is like to be operating like each of you in this room and signing the front of a paycheck, not always the back of a paycheck. So I want to recognize Councilor Shane Matthews for bringing this initiative forward. And now the city council, I want to thank them for nearly a unanimous vote on putting this into motion. We're pleased today to have City of Salem Chief Financial Officer Josh Eggleston with us. We've seen Josh many times as he has partnered with the Salem Chamber on a number of efforts to make sure the city is in a financially stable environment, as well as providing analytical analysis. Josh, the floor is yours, sir.
Thank you, and I appreciate being here again. I just have a couple slides, and really this is just to try to get the program out there. Councilor Matthews made the motion back in October. We implemented the program beginning, I think the official date was November 17th, and we're looking at least a 3-month pilot. And just okay. Goals of the program: support and promote local businesses. So the way city procurement works is a lot of this might be happening right now, but we don't have a consistent way of requiring it. So this prompted some policy changes internally, particularly for purchases up to $100,000. So if you're over $100,000, we have formal procurement rules. We have to go out on organ buys and do a formal solicitation. So I'm going to talk about that too in a second. But up to $100,000, we have buyers in the city. We're a little decentralized, so each department has individual buyers. So what they do is they call, email, and solicit at least 3 bids. And all this policy does is require at least one of those bids to be a within the city of Salem limits, a Salem vendor. If it's available, so we understand that some things just aren't available in Salem, but we're trying to make sure at least Salem's included in that bid process, because there is, it's up to that buyer discretion where they get those bids from. So we're just requiring one to be from the Salem area. This was already happening in some cases, even informally. Councilor Matthews, I think last year we talked about some of our vehicle purchases. So instead of just going with the state contract, we've gone out to bid with Salem dealers and other dealers, and it saved the city thousands of dollars. Not hundreds of thousands, but certainly thousands with that process. And one nuance, so under $5,000, we don't have to do bids. So what we're doing is we're telling buyers to prioritize Salem businesses if it's comparable. The thing I'm trying to prevent is people running around, driving around looking for something. So we want to make sure that, hey, it's efficient and comparable if we're going to do that. But it's really trying to get those kind of the informal bid process, those medium-sized purchases for local vendors. Again, we're looking at 3 months. Likely what will happen after 3 months is we'll bring a report back to City Council, telling them how it went. We're also tracking if it's taking additional time for buyers to do this. And then after that, we'll probably put it into our actual procurement rules. So once we understand some of the guidelines, fine tune some of the requirements, we'll bring a change to our actual procurement rules for council consideration. Where we do need help, and that can really make it more efficient for staff, is to know and understand what businesses are in Salem, particularly those that might not have a web presence. So what we're doing is buyers are looking like, hey, I want to buy XYZ. You can do a Google search. You can look at some other resources. But what we've done is we have a very simple form that 11 businesses have taken advantage of so far. Hopefully that increases after today. If you go to this QR code at the bottom, there's a local supplier interest form where you can fill out.
Hope I'm seeing everybody taking a picture of this right
Yeah.
now. You understand, you should be thrilled to be doing this right now and supplying your company into this ecosystem. So please don't be embarrassed if you're taking this photo right now. Every person in this room in for-profit business should be taking this right now and going to this QR code. So, sorry.
Yeah, no, absolutely. No, I appreciate it. We're trying to keep this really simple. So this just populates a spreadsheet that buyers have access to. So we're looking for some keywords for what your business offers, so they can just do a quick search. Because what we don't want to do is not be able to find a Salem business. We want to be able to just, hey, I'm looking for X, find it in the keyword search or on Google, and make contact, ask for a bid for a certain piece of equipment or service, things like that. Also at this link, so this goes to how to become a city bidder. At the top, if you're not already registered on Oregon Buys, you can register on Oregon Buys to learn about our more formal procurement. So if it's over $100,000 or it's kind of a longer term contract basis, we do those through formal procurements. And if you register on Oregon Buys, you can get notified when the city has an opportunity that has been what your business offers. So I'd recommend please do those two things, at least the local supplier interest forms, because we're having buyers kind of spinning their wheels a little bit if they can't find something. So we're trying to make sure they have easy access to it. And I'm happy to take any questions.
Chris, followed by Scott.
Just real quick, on the 5,000 watermark, for local priorities, what was that based off of that threshold?
Yeah, so it's state law. So just public contracting rules. So over 5,000 to 100,000, it requires a bid tabulation process. Under 5,000, there's not a requirement so you could pick where you want to purchase. So that's where we really should be focusing on Salem businesses, because we don't have to, get 3 bids from 3 different businesses. We can just say, okay, this one looks comparable, and we could just go with that.
Out of curiosity, what is the percentage you would say that is under 5,000 versus between 5,000 and 100,000?
So, I appreciate the question. So our antiquated financial system is a little challenging right now. We're in the middle of an upgrade, and after that, I'll have a little better visibility because it gets kind of mixed up. Because under $5,000, we have lots of things that we still buy that are under contracts with some of our vendors. So isolating this particular niche is a little challenging right now, but it is pretty significant. So if you think of, hey, Parks Department, they need X, Y, and Z. They're stopping by a store and purchasing something. So it is a significant transaction count. I don't think the dollars are, it's not millions of dollars, but it's significant.
Scott, followed by Rich.
So is this gonna be replacing the cooperative purchase agreement mechanism, or are you gonna vote buyers to look outside of the cooperative purchasing agreement?
So they can use the cooperative purchasing agreement as one of the like 3 bid kind of thing. Also what we're looking for is to beat out the cooperative purchasing. So like the state contract, say it's 35,000 for a vehicle. If we can find it locally for 32,000, we'd rather go local. So we're not necessarily going to say replace. It'll be complementary to make sure the city is getting the best value for the dollar.
Rich?
So in your 3-month evaluation, are you taking in the ROI of a local dollar, keeping a local dollar here, and what that does for, reinvestment in even local and basically the tax coming right back to Salem? Is there any factor in that?
Yeah, certainly. So part of the evaluation, when we get that report back to city council, that'll certainly be one of the factors that influences how and what form this continues.
I'll piggyback on Rich. Are you aware that if you invest locally, $1 with a Salem company, 68% of that dollar stays in our community, whereas if you invest $1 with a big box store, 34% stays. So that is a whole 100% value greater if you were purchasing from a local company. So if you need any of those analytics, I'm happy to provide them, as well as the documentation where we have them that is 100% factual. Next question for Josh. Yes, Sawyer.
In my experience, the biggest disconnect for public purchasing agencies typically is not strong enough of a mandate for a direction on where they're supposed to be making their purchases. How much of a rail is there for people to be utilizing this program as a brief period of time?
Are you talking about just like compliance? How do I make sure they're actually doing it, or?
Because typically we see a lot of people just become online shoppers. They go to Amazon, they go to Staples, they go to catalogs versus utilizing local entities that purchase the same things at cheaper rates, or they provide some as compared.
Yeah, so particularly for these level purchases, they do go back through our centralized purchasing group that's in my office. So we see the bid tabulations, and we're going to be looking for those Salem vendors there. Or hey, I spent X amount of time looking for a Salem vendor, I couldn't find one. So we will be looking at that. It's a little more challenging for that $5,000 and less, but certainly for the $5,000 to $100,000, we have a pretty strong compliance mechanism.
Nick.
I realize this is a pilot program, but I don't see why you would, at the end of 3 months, be like, oh, this isn't really working out. If you've got a lot of business owners, especially in this room, who are willing to supply Salem. I mean, do you expect to end it after 3 months, or have a hard evaluation like, this isn't working out, or continue with it?
No, I fully expect to continue with it. I think it's more just fine tuning kind of the policy guideline, right? So I'm in contact with our contracts and procurement manager, and then also the buyers and departments to see, hey, what's challenging about this? And that might be something that I bring to some of you actually, that talk through how we can partner and make things more easy, especially that information piece. But no, I don't expect it to end after 3 months.
One quick follow-up. Are there any other cities that have been doing this for a long period of time, or is Salem the first one?
It's a good question. I think there's a lot of this that happens informally. I haven't really seen a lot of requirements. And again, this is not a local preference. It's making sure that it's a local opportunity, right? So we're still following all our purchasing guidelines, all the state laws about competition. It's just making sure within our policy regulatory environment that we make sure Salem has an opportunity to be competitive.
pretty common sense solution and a way to engage your local business owners. I'm sure this was a unanimous vote. Councillor Matthews, not to put you on the spot, do you recall whether this was a unanimous vote?
That's put me on the spot, huh? Yeah, it was close to a unanimous vote. Wow.
I was a bit facetious, but I can let you know the councillors that did not vote in favor of this, should you be curious. TJ followed by Dick. Councillor Matthews, remind me. Councillor Bang did not vote in favor of this local preference. TJ followed by Dick.
Yeah, I think the other guidelines are the ones you're gonna have to review, because I know, like for the cleaning of downtown, city hired an outfit, but it had to be a QRF, which limited really their scope of what they could do. So this urban development department came to Main Street and said, can you guys assist with hiring other contractors? We hired local contractors, Salem-based contractors. We made sure that everybody actually based it, but also the guys who were doing work live here. And they were able to do a deeper dive in the cleaning of downtown, because we didn't have to hire a QRF.
Yeah, Josh, back in, when Janet Taylor was the mayor, we did exactly this, and we had a committee that they could put input on these on the statewide bids, for example. Of course, I was in the car business, but the cars, favorite deal, when you buy it out of city, then you don't get the your vehicle needs help or it needs repairs or something, and the police have sometimes of they drive very well sometimes.
No comment.
Yeah, but it did really work out really well.
Yeah.
Josh, one thing I'd like to add, you said that, if it takes a little bit longer, then that's gonna be evaluated at 3 month time period. I think for those of us business owners in this community that are paying taxes for the city employees to get their paycheck every month, if it takes a little bit longer to do business locally, we're okay with that. So while I'm a big proponent or advocate, I guess, of being stewards of taxpayer dollars, I would say in this case, maybe not so much. If we needed to spend a little more time to do business here locally, that's exactly what we needed. Furthermore, Josh, I like you. I think you're a really nice guy. I think you're very smart. We should be embarrassed that here we are with a fairly new city councilor, thankfully putting this on the docket here to get it done for us. It's nice to have a city councilor that isn't worried about virtue signaling right now. Maybe think about some common sense type stuff in this community. And we really should, Josh. We should be embarrassed that here we are, December of 2025. I don't know if the city's been around as long as the fire department has, but now we've decided that we should do business locally. That's not good business. That's a culture problem within the city. And frankly, we're tired of it.
I'm going to jump in and actually defend the city a little bit on this one. They are work.
We're almost at our time limit, Tom. We
Just for factuality, though, the city works under a state mandated buying scenario. So I don't think it's always been, but Kevin, I know you got some color too. Here we go.
I would appreciate some feedback from our local government folks about streamlining the process and eliminating some of the restrictions. I bet you the $5,000 figure went back 20 years. They never thought about adjusting it to 10,000, whatever. I would welcome feedback. Now, that would not be something for the short session, but it could be for 2027 when we pass hundreds of bills. But things like this, I think, could have traction, and I welcome some feedback.
Great. Thank you, Kevin, for being open to that. Okay, I want to conclude our meeting here by giving you a preview that I teased at the beginning. Next Thursday, from 2 o'clock to 3 o'clock here in this room on December 11th, we will host a special Business Advocacy Meeting with two sole topics. The first we will hear on the ODOT plan from Representative Ed Deal, who led the campaign to bring this to the ballot. That looks to be certainly a successful citizen initiative to bring this forward. We will also hear conversely from SEIU, is a proponent of keeping the governor's transportation in place. So you're going to hear both sides of that discussion. At the conclusion, we are going to ask you, our members, to take a vote that will be then forward to our executive team and our board of directors for an official position by our organization, which we hope to release prior. The second item, which was teased by Kevin, going to be the death tax initiative. Because as you can imagine, if you remove the death tax, there are now a lack of funds that were previously coming into the state on that behalf. Again, we will hear from SEIU. I'm sorry?
Taxpayers for
Tax Fairness Oregon, pardon me. The union is on one side, and then the Tax Fairness Oregon will provide their commentary on why the elimination of the death tax is not a good idea. So you will again be hearing both sides of this issue on both these key issues for our community. And again, we will take our membership's polling and take that forward to our board of directors for consideration of official position. If this is the type of programming that you feel impactful, and I really appreciate seeing so many people month after month, I want to credit Jameson for great work on this and our board for wonderful work led by Rich Duncan, our advocacy vice president. If this type of programming is important to you and your members, I invite you to bring somebody with you next time. And if you feel this type of programming is important for your businesses, we need to expand this audience and continue to bring people in this room who see the value of it so we can engage people and have intellectually honest conversations of what's occurring in our community. I'd encourage you to connect with Jackie Roche. There are some membership levels that provide incredible access. One of the key functions you hear about quarterly is our Executive Leadership Council. If you have not yet attended and not wishing to understand what that is, it is an investment platform that again provides some key access to elected officials and key influencers. I'll close with this. We have a number of our board of directors in this room. Would you mind standing and identify yourself so our audience can see who they ought to be talking to share great conversations led by President Ted Ferry, Rich Duncan, Angela Williams, BJ Blair, Alan Sorum, Treva Gams, Ryan Dempster, and Bill Rickey. Tremendous showing by our board team. Thank you all for being. Oh, yeah, we got a little thing going on Monday, our Salem Chamber Forum. If you intend to attend, wish to attend, I need to get that absolutely right now. We have turned in numbers to the Salem Convention Center. We are at the seams. Dr. Eric Fruits is coming down from Portland State University to provide us a look into what our economic policies in Oregon have led us to now, and futurism, where we are heading next due to such policies in the environment we have created here in Oregon and restraints on businesses. It's going to be an eye-opening meeting. It is sponsored by Businesses for Community, and we want to make sure all of you are there. Entire series solutions. With that, ladies and gentlemen, we are wrapped. Tremendous holiday season. See you next Thursday in this room, 2 p.m.